Good morning, teacher and classmates. Today I will discuss the cultural differences in dental care between Peru and India. Although both countries value oral health, their customs, tradition, and approach to prevention have evolved differently due to their history, culture, and access to healthcare services. Uh, well, about the differences between Peru and India, what we have at first is the traditional dental care. In this case, in Peru, many families teach children from an early age to brush their teeth with toothpaste and use dental floss. In some rural communities, and they can use natural remedies such as the use of medicinal plants to relieve toothache or gum inflammation. They are also still used. Also, in India, it's common to combine modern dentistry with traditional Ayurvedic practices. We can see that some people use this plant called neem to clean their teeth. Also, they believe that this has some antibacterial properties. Also, with oil resin, it's a practice known as oil pulling, is also frequently used in India. About the diet, in this case, in oral health, the Peruvian diet include fruit, vegetables, and some foods like potatoes and corn. However, the consumption of sugary drinks and sweets can increase the risk of the cavities. Uh, about India, they also consume some sweets, in this case, especially during religious festivals, which can contribute to the development of cavities if proper oral hygiene is not really maintained in this case. Uh, for example, according to the World Health Organization, oral diseases such as tooth decay and gum disease are among the most common not communicable disease worldwide and can be prevented through good oral health hygiene and healthy diet. Also, here we can include the consumption of sweets in this case. Well, also about like I mentioned about Ayurvedic medicine. In this case, according to the Indian Dental Association, Ayurvedic medicine with a history spanning more than 2,000 years recommend traditional practices such as the use of, in this case, neem twigs for dental cleaning and also the practice of oil pulling as a supplement to oral health. Well, another thing is about the access to the dental care. Here in Peru, we have in Peru there is a greater access to the dental clinics in cities, whereas access in some rural areas might be limited by due to the distance or the cost. We can see that here in Peru, in schools, also the students of odontology come to the, in this case, to the schools to check the kids and see that they are brushing their teeth and following the instructions about odontology. In India, they have modern hospital and dental clinics in major cities, but they they have some practices that are not really correct. In this case, we can see that at the streets, people sold, in this case, um, some tools that are have been used also in other patient this case, so they are not really new. Well, In this case, according to Batero, in India there is an informal market for dentures and street dentists who offer their services because they are quick and low cost solutions. Uh, well, about the prostheses, in this case, they can be used in other patients because according to CapDents, the prosthesis reflects each patient oral anatomy, including jaw size, palate shape, and gum position, so it cannot be adapted for or reused by another person. Um, well, now we have the oral hygiene education. Also, like I mentioned, in Peru, some schools promote brushing after meals and regular visit to the dentist. Uh, but in the India, there are also some health education, but it's more related to traditional medicine in this case about the tooth. Although many people maintain traditional practices alongside the recommendation of the dentist. Well, about the similarities, um, we can say about similarities that despite their difference, both countries shape several aspects. In this case, both countries they recognize the importance of preventing dental disease. They consider that daily brushing with toothpaste it's recommended to prevent, in this case, the cavities. There is growing awareness of the need to visit the dentist for preventive checkups. Both Peru and India combine modern knowledge with certain traditional practice. In this case, in Peru, we can use uh, some traditional medicine for dental care. Also, like in the India, they use neem and the oil pulling, like practicing. It complements the healthcare about the tooth, but it don't really replace the brushing teeth and the use of this uh, of the brush in this case. Well, in conclusion, we can say that the cultural differences between Peru and India demonstrate that each society has developed its own ways of maintaining oral health. While Peru relies primarily on modern dentistry, India retains certain traditional practice such as the use of neem and oil pulling. Nevertheless, both countries share the same goal, maintaining good dental health and preventing, in this case, disease. So, about the differences, they have the same goal, the same position is to prevent the diseases and prevent the cavities in mouth. So, both we can say that both countries, in this case, Peru and India, have good customs about the oral health. Thank you, teacher, and thank you, classmates.